Hello and Assalamu alaikum. Ultrascan Diagnosis. This is the CBCT of your requested patient. The area of interest highlighted by our dentist is the upper central incisors and the upper lateral incisors. This is the 3D rendering. We do see a little bit of a periapical pathology on the 3D rendering. This is the panoramic view of the patient. The upper four have crowns and prosthesis on them, and all four teeth have been root canal treated. Now we will take you to the transaxial view of each tooth so that you can have a look at the tooth from a different perspective. This is the upper right lateral incisor. Here we can see that root canal treatment is done. Even though the obturation is still the apex, we do see voids, we do see a periapical pathology present at the apex. I'm just going to zoom in for our dentist. So this is the root canal obturation material. We can see that it is not very adequate. We do see a little bit of voids in the canal, and we also see overhangs in the restoration, and there is a periapical radiolucency present underneath this tooth. Moving to the upper right central incisor, the upper right central incisor root canal material appears to be absolutely correct. There doesn't seem to be many voids in the middle to apical third. We do see very slight extrusion, and we also see that there is a dehiscence at near the apex in the buccal cortical plate, but no as such periapical radiolucencies can be seen associated with the upper right central incisor. Moving to the upper left central incisor, here we can see that the upper left central incisor is over obturated. The GP has been extruded by approximately 2.5 millimeters outside the apex. We don't see any voids, we don't see any major radiolucencies, but we do see that the extruded GP has caused dehiscence at the apex, which can also be seen in the 3D rendering right here. Moving to the upper right lateral incisor, here we can see that the obturation is again not very adequate. We can see voids present in the middle and in the coronal third. We don't, however, see any periapical radiolucencies, and we don't see any overextended GP present. We do see overhangs present in the restoration. So this is the axial view of the patient. Here we can show you the axial section, and in the axial section it is clearly visible. All four obturations can be seen adequately here. Just slightly zoom in. There we go. So the obturations do seem to be a little voidy in the lateral incisors, but they seem to be appropriate in the central incisors. As we move to the upper right lateral incisors, here is the radiolucency associated with it. The upper left lateral incisor does not have a radiolucency. This is the overextended GP that can be seen, which is out of the cortical plate in the upper maxillary region, upper left maxillary region. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.